Medical coding. DRGs, ICD-10, CPTs. Sounds like a foreign language, right? Something completely separate from your direct patient care, handled by another department? That's what many nurses were led to believe, but it's a critical misunderstanding holding back your power. You might not assign the final codes, but were you ever taught that your documentation is the essential key, the Rosetta Stone, that translates every assessment, every intervention, into the language hospitals use to get paid? That feeling that your detailed notes vanish into a void, disconnected from the hospital's bottom line? That ends today. Welcome back to the Healthcare Nurses Network and Nurses Link Up mobile app podcast series. This is Breaking the Code, Nurses Unlocking Revenue Cycle Management. This series is your essential guide, delivering the financial knowledge you deserve to navigate the full healthcare landscape effectively. In Episode 4, we decode the mystery with Introduction to Coding, Understanding DRGs, ICD-10, and CPT codes written by Dr. Nicholas Abella. You'll discover the basics explained. We'll demystify DRGs, ICD-10, CPT, and HCC codes, not to make you a coder, but to reveal their direct link to your work. Your documentation's power, how the specific details you record about severity, comorbidities, and interventions are the absolute foundation for accurate coding and reimbursement. Preventing costly errors, learn how clear, comprehensive nursing notes stop coding mistakes, reduce claim denials, and ensure your hospital captures the true cost of care. Guiding you through these essential strategies are your hosts, ICU nurse, James Carter, BSN, RN, and nurse manager, Emily Ramirez, MSN, RN. Get ready to break the code. Your RCM transformation starts right now.
Hey everyone, and welcome back to the Healthcare Nurses Network podcast. We're thrilled you're tuning in with us again.
It's great to be here.
We're all about giving you the knowledge and tools you need to excel in your nursing careers, to make a real difference in your patients' lives, and feel confident and supported every step of the way.
And today we're into a topic that's absolutely essential for the financial well-being of your hospital and that directly impacts the resources available for you to deliver that top-notch patient care that we're always talking about.
Yeah, you were talking about medical coding.
Now I know what you might be thinking. Medical coding, that's for the billing department, right?
That's what I thought first too, but trust me on this one.
It's way more connected to the work you do every single day than you might realize. And we've heard from so many of you asking for a clearer picture of how all the pieces of the healthcare puzzle fit together. So
this is for you. We're going to break down those sometimes confusing acronyms like DRGs, ICD-10 CPT codes, and HCCs.
We'll show you how the detailed charting and documentation you do at the bedside, the things you may think are just routine, actually have a ripple effect throughout the entire hospital system.
And how they directly translate into the financial resources that make quality care possible.
So let's get started with diagnosis-related groups, or DRGs as they're commonly known.
DRGs.
Now, these are how hospitals get paid for inpatient stays.
Oh.
Basically, every time a patient is admitted to the hospital, their case is categorized into one of these DRGs.
So kind of like a filing system.
Exactly. And each DRG has a set payment amount attached to it. So let's say you have two patients, both admitted with pneumonia. One patient has a relatively straightforward case. They respond well to treatment and are discharged after a few days. The other patient has a much more complex case. Maybe they have other health issues that complicate their pneumonia, or they require a longer hospital stay with more intensive care.
Right, so they'd fall into different DRGs then.
Precisely. And the DRG for the more complex patient would likely have a higher payment amount, because it reflects the greater resources and level of care that patient needed.
Got it. So the DRGs are designed to take into account the severity of the illness and the intensity of the care provided. Makes sense.
And here's where you come in as nurses. Your detailed documentation is crucial in ensuring that a patient's case is assigned to the correct DRG.
Really? Our documentation can affect how the hospital gets paid.
Absolutely. Think about it. You're the ones at the bedside 24/7. You're monitoring the patient's vital signs, administering medications, providing treatments, and observing their response to all of those interventions.
Right, we're seeing the whole picture of how the patient is doing.
Exactly, and all those details, you document those careful observations, those specific interventions, those little things that you may think are insignificant. They all contribute to painting a complete picture of the patient's condition and the complexity of their care.
So if our documentation isn't thorough enough, The hospital might not be reimbursed for the full extent of the care that was provided.
That's exactly right. And that means fewer resources available for things like new equipment staffing, continuing education for nurses, and ultimately for providing the best possible care for your patients.
Wow. Okay. Starting to see how this all connects.
Hmm.
So what are some specific examples of things that nurses should be focusing on documenting to make sure those DRG assignments are as accurate as possible?
Great question. Let's break it down into a few key areas. First, comorbidities and chronic conditions. Let's say you're caring for that patient with pneumonia, and you notice in their chart that they also have diabetes. Now, simply noting diabetes isn't enough.
So what else should we be documenting?
You want to paint a detailed picture of how that diabetes is impacting their hospital stay. How often are you checking their blood sugar levels? What type of insulin are you giving and how much? Are they experiencing any complications related to their diabetes, like high or low blood sugar? All of these details contribute to the overall complexity of the patient's care.
Got it. So it's not just about listing the diagnosis, but showing how that diagnosis is actively influencing their care.
Precisely. Now, another critical area is the severity of the patient's condition. Let's stick with our pneumonia example. If your patient is having significant trouble breathing, needing high levels of oxygen, or even requiring a ventilator to support their breathing, that needs to be clearly and thoroughly documented.
So we're talking about being very specific about their symptoms and the level of intervention they require.
Exactly. The more detailed your documentation is, the better it supports the medical necessity of those interventions and helps justify a higher level of care and potentially a higher paying DRG.
It all makes so much sense when you explain it like this.
It
And
is-
it makes me realize how important it is to be diligent about those seemingly small details in my documentation.
Absolutely. All adds up. What else should we be focusing on?
Well, you mentioned interventions and treatments. What do we need to keep in mind there?
Again, it's all about the specifics. Don't just write IV antibiotics given. Instead, document the name of the antibiotic, the dosage, the frequency, and the route of administration. And very importantly, document the patient's response to that treatment. Did their fever go down? Did their white blood cell count improve? All of these details are critical in demonstrating the effectiveness of the care you're providing.
It's like building a case file for every intervention we do.
That's a great analogy. And don't forget about patient education and discharge planning. If you spend time teaching a patient how to manage their medications or how to care for a wound at home, document that information. Don't just say patient education provided. Be specific about what topics you covered, how you taught them, and the patient's understanding of that information.
So it's about showing that we're going above and beyond just treating them in the hospital, but also setting them up for success after they go home.
Exactly. It all contributes to the overall picture of comprehensive care.
Okay, I'm feeling much more confident about my DRG documentation now. What's next?
Next up, we have ICD-10 codes. These are the standardized codes used to classify diagnoses and health conditions across the board in healthcare.
So basically, every diagnosis has a specific code.
Exactly. And these codes are used for everything from billing to tracking public health data to researching new treatments.
Wow, they have a lot of uses.
They really do. And although nurses aren't typically the ones assigning these codes, the information you document is essential for the medical coders who do.
So they rely on our notes to make sure they choose the correct code.
That's right. So let's say a physician diagnoses a patient with congestive heart failure. That's the starting point.
Okay.
But your nursing documentation is what adds all the important details that allow the coder to choose the most specific and accurate ICD-10 code for that patient's condition.
Give me an example.
Okay, so you might document things like the severity of their shortness of breath, whether they're needing oxygen, how much swelling they have in their legs, if their heart rate is irregular, any medications they're taking, and how well those medications are working.
So we're really painting a picture of their individual experience with that diagnosis.
Precisely. And those details are crucial because they help the coder determine the severity and complexity of the patient's heart failure, which then influences the ICD-10 code they choose.
And the more accurate the code, the more likely the hospital is to receive appropriate reimbursement.
You got it. It's all connected. And that brings us to CPT codes.
All right, CPT codes. Hit me with it.
Now, CPT codes are all about the procedures and services that are provided to a patient.
So while ICD-10 codes tell us why the patient is being seen, CPT codes tell us what was done to treat them.
Exactly. That's a great way to put it.
So for instance, if a patient has an X-ray, there would be a specific CPT code for that.
There would. And there's a CPT code for practically everything from a simple blood draw to a complex surgery.
And once again, our documentation plays a role in making sure these codes are accurate.
Absolutely. For example, let's say you administer a medication through an IV. You need to document the name of the medication, the dosage, the route of administration, and the time it was given. That information allows the coder to select the correct CPT code for that specific medication administration.
Okay, so it's about being meticulous with those details.
Precisely. And for some procedures like wound care, the documentation needs to be even more detailed. Think about a wound dressing change. You need to document the size and location of the wound, the type of dressing used, any debridement that was performed, and how the patient tolerated the procedure.
The more information, the better.
Exactly. And the more accurate the CPT coding, the better the hospital is able to track the services it's providing and ensure it's being appropriately reimbursed for those services.
Makes sense. Okay, on to the last one, hierarchical condition categories, or HCCs.
HCCs. Now, these are particularly important for patients with chronic conditions.
Okay, tell me more.
So HCCs are used to predict healthcare costs and risk for patients in Medicare Advantage plans. You know, the private insurance plans that people can choose to enroll in once they're eligible for Medicare.
Yeah, I've heard of those.
Well, the idea behind HCCs is that patients with more chronic conditions or more severe chronic conditions are likely to have higher healthcare costs.
That makes sense.
Right? So these HCC codes are used to adjust payments to healthcare providers to reflect the risk and complexity of their patient population.
So basically, providers caring for sicker patients receive higher reimbursement to account for the increased costs of caring for those patients.
Exactly. And you guessed it, your documentation is essential for accurate HCC coding.
I think I'm getting the hang of this now.
If a patient has diabetes, you want to document the type of diabetes they have, any complications like nerve damage or kidney problems, how well their blood sugar is controlled, and what medications they're taking. All of these details factor into their HCC score.
And that score determines how much the healthcare provider is reimbursed for their care.
Precisely. So you can see how your documentation directly impacts the financial stability of the entire healthcare system.
It's amazing to think that the details we record every day have such far-reaching consequences.
It truly is. Your documentation is the foundation upon which the entire system of medical billing and reimbursement is built.
It's like we're all little cogs in this big machine.
And every cog is important. And that's why it's so important for nurses to understand the significance of their documentation. Even though you may not be the ones directly assigning the codes, your notes are crucial in guiding those who do.
So let's recap what we've learned today. Why should nurses care about medical coding, even if they aren't responsible for assigning those codes themselves?
Well, first and foremost, because your documentation directly impacts the financial health of your hospital and ultimately the resources available to care for your patients.
So we're not just writing these notes for the sake of it. They actually have real-world consequences.
Exactly. Second, accurate coding helps ensure that hospitals are properly reimbursed for the care they provide, which means more resources for staffing equipment and new technologies.
And all of that benefits both nurses and patients.
Absolutely. And third, detailed documentation helps to minimize claim denials, which saves everyone time and frustration.
It's about working smarter, not harder, right?
Exactly. And when claims are processed efficiently, it frees up administrative staff to focus on other important tasks.
So it's a win-win all around.
It really is. So what can nurses do to improve their documentation and contribute to greater coding accuracy?
Well, first, prioritize thorough and specific documentation of key patient interactions and conditions. Don't just write patient stable or no complaints.
Be specific about what you observed, what interventions you performed, and how the patient responded.
Second, aim to document in real time whenever possible. The longer you wait, the more likely you are to forget important details.
Those little things that may not seem important at the time can actually make a big difference in terms of coding accuracy.
Third, use clear and consistent language. Stick to standardized medical terminology and avoid using vague or ambiguous terms.
And if you're ever unsure about how to document something, don't hesitate to ask for clarification from a supervisor or a coding specialist.
It's always better to be safe than sorry.
And lastly, remember that your documentation is more than just a record of care. It's a vital communication tool that informs the entire healthcare team about your patient's needs and progress.
It's about painting a complete and accurate picture of their healthcare journey.
Exactly. And when you understand the importance of your role in that process, it can be incredibly empowering.
Absolutely. So to all our amazing nurses out there, keep up the great work.
Yeah.
You are the backbone of the healthcare system, and your dedication and attention to detail make a world of difference.
Couldn't have said it better myself.
And if you're looking for more resources and support to help you thrive in your nursing career, be sure to check out healthcarenurses.net. You can also download our Nurses Link Up app, available on the Apple Store and Google Play Store. It's a fantastic way to connect with a community of like-minded nurses, access evidence-based resources, and stay up to date on the latest healthcare news.
We highly recommend it.
Thank you for listening to the Healthcare Nurses Network podcast. We'll see you next time.